State of Washington versus McKesson, Cardinal Health, and AmerisourceBergen by Gunvor, Gage, Manny, and Talia. This is our case information. The plaintiffs in this case were the state of Washington and their lawyers, which we have a list of their lawyers right there. The defendants in this case were as follows: McKesson Corporation, Cardinal Health Inc., AmerisourceBergen Drug Corporation, along with their lawyers. The background of this case. The state claimed that the companies AmerisourceBergen Drug Corporation, Cardinal Health Inc., and McKesson Corporation contributed to the opioid epidemic in the state of Washington by not blocking shipments of suspicious orders for prescription opioids, and that the companies shipped too many opioids to hospitals and pharmacies in Washington. Due to this and a public nuisance torts claim, the state wants to hold the companies liable for the contribution to the opioid crisis. The state sees the companies as liable because the distributors engaged in unlawful and unreasonable conduct in distributing opioids in Washington by failing to stop shipments of suspicious orders before 2007, using inflated thresholds as triggers for suspicion and investigation, and sending large amounts of supplies out to prescription providers. However, the companies claim that the increase in opioid distribution is caused by an increase in providers prescribing opioids. That is, the prescribing decisions were made by doctors to meet the medical standards for patient care and pain management, and the distributors had no ability to second guess their decision. The outcome of this case was that Washington State got $518 million in the settlement from the opioid distributors. This came after Washington Attorney General at the time, Bob Ferguson, rejected a national settlement and instead pursued the case in King County Superior Court. The state won on the grounds, and they failed to monitor and report suspicious shipments and shipped overly large quantities out, which significantly contributed to the opioid epidemic facing the state. The laws that the opioid companies violated were state laws. These laws include RCW 7.48.010, which is an actionable public nuisance by injuring the public, as well as RCW 69.50.303A1. Because they were dispensing a controlled substance without following a commission standards. Other than the primary stakeholders, the secondary stakeholders are the affected individuals and families, since they were direct victims to the crisis, public health departments because they lead opioid prevention, treatment and recovery plus healthcare providers and first responders for managing medical and emergency fallout, advocacy groups, nonprofits, and community organizations for pushing transparency and delivering support and services, and taxpayers because they fund the crisis response and have a stake in the settlement money. Precedents. State v. Mandatory Poster Agency, which was used to confirm that the defendants acted in bad faith by deliberately oversupplying the state, as well as confirm that the defendant caused substantial public injury and owed civil penalties. Magny versus Lincoln Mutsav Bank used confirmation that the defendants had violated the Consumer Protection Act and provided lack of due diligence by oppressing anyone who oppressed their actions. Unethical, ignoring information that provided opioids were diverted into Washington and oversupplied the state with opioids. Good law and the case's decisions influenced. Although this case is not on Westlaw, it seems that the case is still good law, but it is still subject to change over time as any law is. There are also other cases which are very similar and have happened recently that have the same verdict as this case. Some of those cases being State versus Mandatory Poster Agency, in which this case was used to affirm that the defendants were acting in bad faith by continuing to oversupply Washington State despite warnings from the DEA. Moreover, this affirmation underpinned the plaintiff's argument that these actions cause substantial public injury and the defendants owed substantial civil penalties. This case was integral in awarding the plaintiffs winning $518 million in damages for Washington State. The Magny versus Lincoln case was used by the courts to affirm a violation of the Consumer Protection Act due to antitrust regulations, and to prove a lack of due diligence on 3 grounds: failing to enact protective controls on the incoming opioid shipments, oppressing anyone in opposition of their actions, and unethically ignoring information that proved the opioid shipments to Washington were diverted and henceforth oversupplied the state. 2 cases that were influenced by this case were the City of Baltimore versus McKesson and AmerisourceBergen, which in 2024 a verdict was passed in which a Baltimore jury found McKesson and AmerisourceBergen liable for part of their city's opioid epidemic, and the City of Baltimore was awarded $266 million in damages from the case. Another case is State of Alabama versus Johnson & Johnson, McKesson, and Endo, in which this suit ended in Alabama's favor, in which there was a payout of $276 million in 2022 for the role that these companies played in the opioid epidemic in Alabama. For opinions, we start off with Gunvor, in which they agree with the ruling because they think that it is important that large corporations are held accountable for the damages they inflict on people and families. Opioid companies knew that their products were addictive and harmful, and yet they did everything within their power to maximize profit instead of protecting the people. They purposefully went out of their way to avoid flagging and checking suspicious orders by inflating thresholds that triggered investigations and sent out overly large quantities. They did this just to get a better payout, even though they knew that their actions could harm people by increasing the number of opioids people were getting. Their actions have led to a large opioid abuse crisis in the state of Washington. It is time that these companies pay for the wreckage they have influenced on the lives of people by paying for treatment programs, wraparound services, for housing and other basic needs, programs that prevent overdoses, support for first responders at the front lines of this crisis, and other services. Gage states that they agree with the ruling for many reasons, mainly being that these large corporations know the issue that these opioids were causing and still decided to continue distributing for profit. Opioids are highly addictive and can be extremely harmful in many ways, whether through the actual addiction or the effects of having this addiction. There is no justifiable reason to do this, and even less so when the reasoning is to make money for their company. These addictions cause a lot of pain and suffering to many people and the families of them, physically, mentally, and financially. And these companies should be held accountable for their actions, considering they knew that the effects that these opioids were having on their customers. These corporations are one of the leading factors for the opioid crisis within Washington through sending out overly large shipments and increasing the thresholds to avoid being flagged, and not caring about the effects that these choices may cause in the future. Because of this, they heavily agree with the ruling that was made. Manny says that they agree with the ruling of this case because the effects of the distribution of the opioids will potentially have a long-lasting physical, mental, and emotional effect on the people who are directly at harm. The drug is highly addictive, and knowingly still spreading it deserves the right consequences. The settlement's focus on prevention and treatment is vital. Still, stronger oversight and ongoing support is needed to truly address the epidemic's root causes. Collier states that they also agree with the court's decisions to award the state of Washington damages. The defendants candidly breached state consumer protection regulations by diverting shipment amounts, ignoring regulatory warnings, and granting unlawful threshold increases. Their negligent actions directly contributed to over 10,000 opioid-related deaths. If the courts had decided differently, it not only would leave citizens vulnerable to the harms of systematically incentivized opioid use, but it could have perpetual effects on the victims of opioids, their families, and their surrounding community. Moreover, corporations, especially those that create potentially addictive medication, should realize the duty of care in the regulation and distribution of their goods in hopes of curtailing preventable harms.